Hi, this morning, myself, David Cohen, and my colleagues Brian Kim, Joe Marola, and Ken Temecki spoke about clinical tips in eczema. My tips related to facial dermatitis, which are particularly vexing in taking care of eczema patients. Most patients who treat with systemics have facial dermatitis and they'll respond. Occasionally they won't respond, may get worse, or there may be treatment emergent facial dermatitis. Treatment with topicals usually does the job, but sometimes therapies that require a switch or a dose reduction may be necessary.
Hi, I'm Brian Kim. My one pearl was that patients with eczema actually have acute itch flares, and you can potentially target this with omalizumab by blocking IgE. How do you recognize these patients? They might have partial response to antihistamines. They will correlate their itch with allergens like house dust mite or cat or dog dander, but also this extends to urticaria as well, potentially. We are also recognizing that patients with urticaria might not even have hives, but they might have a similar pattern of allergen or acute itch flares that can also be targeted with omalizumab.
Hi, I'm Joe Marola. I'm a dermatologist and rheumatologist from Boston. Delighted to be here at Winter Clinical 2023.
Ken Temecki, Cleveland, Ohio, dermatologist at the Cleveland Clinic. Glad to be in Hawaii during the winter.
So we shared a session today on atopic dermatitis and infectious diseases. Really fun session, rapid fire. I covered a little bit about an interesting new topic that I think some of us are seeing, which is dupilumab-associated arthritis. There's sort of an association, unclear etiology. I think at present, there's a few take-home messages. One is if you're seeing a patient with what seems to be a dupilumab-associated arthritis, do think about a differential diagnosis for inflammatory arthritis. Most of these cases, it seems, are able to be treated through. We don't necessarily have to stop treatment. We think about NSAID use, maybe a pause in therapy. For more severe cases, we've talked about brief prednisone tapers. We talked a little bit about potentially adding DMARDs such as methotrexate. And in some cases, switching to JAK inhibitors, which cover both atopic dermatitis and inflammatory arthritis, may make sense. There's a nice study we covered from EULAR, about 400 patients, 23 of which had this particular condition. I think was sort of a highlight of the topic. And I'll turn it over to Ken.
Sure. Given the theme that the theme was indeed eczema and ID, and I'm an ID guy, I opted to cover that spectrum together. And given the fact that we're in Hawaii, I covered a few select marine envenomations, meaning critters in the water, critters in the sea that can inflict us, and cause pain, harm, perhaps even death. And I covered three in particular: the box jellyfish, the Portuguese man-of-war, and some of the spiny poisonous fish. All of these critters are potential problems. And altogether, they and other marine envenomations represent about 10% of all travel-related maladies or inflictions. So given the fact that we're in paradise, we're in Hawaii, we're surrounded by water, what better way than to touch the water and see what's in the water that can hurt us, can inflict pain, aggravation, maybe even death for some folks. And that's what the box jellyfish can do. It can kill you. It is one of the most potent animals in the world. It's a fish. It's a carnivore, so it likes other fish and it likes human skin. You don't want to meet this critter because you may not last long if you get nailed by it. Portuguese man-of-war comes from the description of the warship, the Portuguese man-of-war. It's not quite as deadly, not quite as much of a problem, but it can inflict harm, and on the skin a flagellated erythema with welts and almost what look like scratch marks on the skin, as if you've been whipped into place. You're going to be uncomfortable, you're going to hurt, and you're going to be telling many tales about it for the next few days. And the spiny poisonous fish look pretty, but you want to keep their distance from them. And you really may not be able to see them because in the water, as you walk along the corals on the sandy edge of the beach, you may not see them because they hide themselves within the camouflage of the sand and the reefs very nicely. But these critters are available for you to see, admire, and maybe be touched by around the world. Mainly the Pacific, Oceania, less so the Atlantic.
So make no mistake, Ken tried scaring us all out of the ocean.
I did.
Didn't work. We're all still jumping in, having a great time.
Right. And the take-home message is if you see any of these critters, keep your distance. They're not very friendly, not at all.